Hello, my name is Carol Bolton, and I am sitting here right now at the Mayo Clinic in Rochester, Minnesota. And I just want to share a little bit with you about how I came to the Mayo Clinic and became a patient, and also my journey here. I have sclerosing mesenteritis, which is a disease of the mesentery and the small bowel. In fact, it is a tumor in the small bowel, a non-malignant tumor. This tumor has affected my digestive system and has made it very difficult for me in many ways to enjoy some of the things in day-to-day living. Let me tell you a little bit about myself though first. I am a chief nursing officer and I am a registered nurse. So from both the side of knowledge and the side of the lay person like you, I had to find my way to this disease and to get care for this disease. So how I started my journey was like this. I had chronic abdominal pain for a long time, and I sought care locally in California where I live, and I received some very good care and some very good advice, but I still continued on with the pain. So finally, one of my gastroenterologists said, why don't we do a CAT scan? So a CAT scan was done, and during this time they found the mass on my mesentery. The mesentery is like an apron-like structure that covers the small bowel, brings the blood supply and nourishment to our small bowel. Naturally, right away, I was fearful because I heard tumor and I heard small bowel, and naturally I thought cancer. We did a biopsy of that, and lo and behold, it wasn't malignant, it wasn't cancerous. Although it does behave like cancer because it has feelers and fibrosis that cover the mesentery. I didn't really know what I was going to do, so I started to do some research on my own. And I got on the internet, and I just put in symptoms, and I put in my disease and of the biopsy to find out just exactly what it was. And I found sclerosing mesenteritis was a very, very rare disease. Less than 200 people had it diagnosed in the United States. But when I looked further, I looked at the Mayo Clinic. Because I had had experience with the Mayo Clinic in 1977 with my young daughter, we brought her here for surgery. I was familiar with the Mayo Clinic and the wonderful work they did for all people. So I found out when I looked into the gastroenterology area on the website, I found my diagnosis of sclerosing mesenteritis. And I was very happy, and I contacted the department, and lo and behold, I even found Dr. Daryl Party, who has become my primary care physician for this disease. He was doing research on sclerosing mesenteritis, so I really, really felt blessed. My insurance, unfortunately, wasn't going to cover this, and so I was concerned about that too, because I was in a network insurance. But because I was in a network insurance, and this is a very rare disease, my insurance company did their research, and I can have my care here because this is where the care could be provided for my disease. So let me tell you a little bit more about my disease before I tell you about my care and how my disease has sort of impacted my life. Like you have abdominal pain. I have abdominal pain probably every day, and more so when I eat. I have trouble with certain foods that I can't eat, like fiber foods or hard to digest red meats. So I have learned over time that we have to adjust to our disease and not let the disease adjust to us, because we have to have a total change in our lifestyle. But if we make that change in our lifestyle, then we can cope with this illness. I continue to work full-time as a chief nursing officer 5 days a week in a highly stressful job and do a good job at what I do. And the reason why is because I have learned to live with the disease. The Mayo Clinic in Rochester, Minnesota has helped me with learning how to cope with my disease. When I came here the first time, 4 years ago, and I saw Dr. Party, he did an extensive exam on me. And it was found at that time that I could be treated medically. In fact, preferably to be treated medically versus surgically. Because with this disease, they want to treat you as much as possible medically so that you don't develop further sclerosing or fibrous, or even call it scar tissue if you will, because that's really what it is. And anytime we open into a surgical procedure, of course, we have the opportunity to develop more scar tissue. So when I came here, Dr. Party put me on my medications that were appropriate for me, and I went home and I took them. I adjusted my lifestyle, trying to reduce my stress, trying to take my personality, type A, and get it under control, and my worries, which all play a part in any visceral or abdominal disease, exacerbating or making worse those symptoms. I took my medication faithfully, and I did very, very well. Very well. In fact, I'm so thankful that I make my trip to the Mayo Clinic every year to see Dr. Party and have him adjust the plan of care that he has developed for me. Over the years, as I shared with you at the beginning, the disease may progress somewhat, but we have the opportunity again to make changes in that care and in what we need to do to fine-tune and be able to go forward and live with this disease. You will read, if you Google this disease, there have been almost no people that have died of sclerosing mesenteritis. Like other diseases, like diabetes, hypertension, heart disease, any of those diseases can be nicely controlled if we cooperate and we get the help that we need. Some of you may be a little bit fearful, thinking, wow, can I go clear out to the Mayo Clinic? That's a long ways from where I live. It's almost 2,500 miles from where I live. But I make this journey, and I make it very, very happily, because I know that the care that I receive at the Mayo Clinic is the care that has helped me to be able to move on like I have moved. So I would just encourage you, if you have sclerosing mesenteritis, to realize several points. Number one, it's not a disease that you will probably die from. Number two, it's a disease that can be well managed with a change in your lifestyle, a big change in your attitude, and realizing that you're not going to let the disease conquer you, but you will conquer the disease. And number three, don't be hesitant to get care, to get that care where you can get the best care. And for me, that care has been here at the Mayo Clinic.